Enough is enough. It's the Northern Territory Government's latest response to problem drinking. A recent report into alcohol-related harm showed Territorians were drinking more than 15 litres of pure alcohol a year for every man, woman and child over 14 years of age. The alcohol-related harm is estimated to be costing the Territory more than $640 million a year. The Minister for Alcohol Policy, Delia, Lawrie, this week released sweeping reforms that she says will turn the situation around. I caught up with her earlier today. Delia, Lawrie, welcome to the program.
Thank you, Laetitia.
Statistics show that Indigenous and non-Indigenous Territorians drink at rates 50% higher than the national average. How does this program go about addressing those alcohol problems in both sectors of the community?
Sure, well, what our plan does is we don't discriminate. It's any Territorian who has a chronic alcohol problem. What we do know is the Territory has 3 times the national rate of alcohol-related deaths. That's a tragedy that's occurring in our community. Double the hospital admissions are related to alcohol in the Territory compared to nationally. We're looking at about 50% of our road toll has a higher than legal alcohol blood concentration in there. And also, tragically as well, 60% of our assaults, our domestic violence are alcohol related. We have a significant problem with what alcohol is doing to Territorians.
Isn't a primary focus of this plan Aboriginal problem drinkers? What about the non-Indigenous heavy drinkers in pubs and clubs around the Territory?
Actually, this is focused on anyone who has a chronic drinking problem, and I think people are kidding themselves if they think it's just Indigenous. Non-Indigenous Territorians drink at 1.5 times the national rate. Indigenous drink at 1.7 times the national rate. So it's actually a whole of community problem. In terms of the precincts and the pubs and the clubs, what we've found is 30% of alcohol is consumed on premise, so in your pubs and clubs. 70% of alcohol in the Territory is consumed off premise. It's the off premise that's insidious. It's the off premise that is the domestic violence. That is a lot of the assaults that are occurring, the problems you're seeing in your parks, on your beaches, etc. We had to tackle the off-premise, which is why we've brought in this enormous reform. We will interface, though, with on-premise. The clubs are very interested in interfacing with the ID system because they don't want the banned drinkers moving in and causing problems inside the premises. Anyone drinking in a premise is fundamentally more controlled in terms of their drinking habits and safer. So there's a responsible service of alcohol.
What evidence is there that these police-based methods work? We've had in the past antisocial behaviour laws, we've had dry communities, we've had programs where Territorians have had to sign and show ID to get alcohol. Why is this program any different?
Well, certainly what we've seen is where you've got a banned drinker register in place, say for example in Alice Springs and Katherine, we have seen dramatic reductions in the pure alcohol, 18% reduction in the sale of pure alcohol in Alice Springs. Critically, though, in the evaluations we've done, a 21% reduction in serious assaults. The feedback we're getting from certainly the trauma people at Alice Springs Hospital has been quite a dramatic change. So we've seen the evidence of what's worked in the Territory. We've taken what's worked. We've seen where the gaps are, though, because we still have 54,000 incidents a year of people going into police protective custody. And we have 21,000 incidents a year of people going in and out of the sobering up shelters. So what we're seeing is this chronic alcoholic cohort who are in and out of the services but not going into the treatment services. So we've designed a system that traps them into the no access to alcohol, which is the bans for 3 months from alcohol, and incentives in there for them to get into alcohol treatment and mandatory treatment by the establishment of the new Alcohol and Drug Tribunal and the enhanced powers of the Alcohol Court that will merge with the Drug Court into a new smart court.
What restrictions are there to ensure that police are using their new powers in an appropriate way, that they aren't just able to slap bans on people indiscriminately?
Oh, absolutely. Really good question. 3 times in and out of protective custody within 3 months is a pretty big bar to set. Most of us have never been in police protective custody in our lives, let alone 3 times in 3 months. We could have done, say, for example, 3 times in 12 months, where you would have caught a broader cohort of people. We wanted to go after the real chronic alcoholics. So to meet that test of 3 times in 3 months in police protective custody, you've got a chronic alcohol problem. To be taken into police custody for your own protection is a big issue. And so that's the first fundamental test. We've also established a tribunal. So that can review the decisions police are making on those administrative bans. So if someone has an administrative ban placed on them because they've been 3 times into police protective custody in 3 months, they can say, actually, you got it wrong. I'm going to the tribunal to prove you got it wrong. It wasn't me that 3rd time. I was actually in California. You always need a house of review, appeal. That's why we established the tribunal. The other good point to that tribunal, though, is people can refer people into the tribunal. So the workers in sobering up shelters, doctors, family members can refer people to the tribunal, but there are clinical assessments, gatekeepers, if you like, the tribunal, so that you can't just, dob in a mate because you feel like it. They would be clinically assessed.
These proposals do have significant resourcing implications. We're talking about $20 million just for the treatment facilities. On top of that, there's policing costs, administrative costs, the court reforms. Realistically, where is the money going to come from to ensure all of this can be implemented?
Look, I do want to say that these reforms are about targeting the banned drinkers. They're not going to affect everyone else who goes about their daily lives. There will be no change. We've had evaluations and we've seen the reports done. It shows us $642 million a year is the cost of what alcohol is doing across our community. So that's from health costs right through to your corrections costs. So there's a real cost driver in there. That's not why we're doing it, by the way. We're doing it because of the social harm. But the pure economics tell you $642 million a year to tackle the problem, yet we're seeing a recidivist cycle occurring in our community, more harm occurring. We recognise that we can't do it on our own. We will work in partnership with the Commonwealth Government and with local government. I think you've seen with the Darwin and Palmerston alcohol management plan that we've put out there, the councils are on board. They want this to happen too. We're certainly committed as a Territory Government to the funding of this. We've committed to funding the IT systems to support it, to rolling out the infrastructure so that the small business doesn't have to pay. We're going to cover those costs. In terms of the alcohol and rehab, we've seen significant investment in the last few years from the Commonwealth Government. We've seen an increase in rehab beds and sobering up shelter beds. There's about 300 now across the Territory. I'm confident that whether Julia Gillard is the Prime Minister or Tony Abbott is the Prime Minister, we will work with them to get that all-important tens of millions of dollars of increased funding. At the end of the day, if they don't step up, we're prepared to.
Delia, Lawrie, thank you for joining us.
Thank you.